Doctor, just when it feels like the coast is clear, we do really have what feels like a reopening of America. We're just talking about, some of these theme parks opening in Orlando. We're getting new reports that this fall is going to be worse, and we really will have a second wave. If you were, I hate to say this, if you had to handicap the situation at this point, how do you handicap it?
Well, I think there's a high likelihood this is coming back in the fall. Whether or not we get a full-blown epidemic across the United States is really going to depend on some of the measures that we take. Some of this is out of our control. But if we have very aggressive tracking and tracing in the fall and screening in place,
right,
and we're doing the right things, we can mitigate that. This is a new study that did modeling looking at coronaviruses historically and also looking at pandemics and predicted that it's likely to come back in the fall. But it's something that we've known.
Do you think we have those things in place? Because anecdotally, we're hearing less about that. Yes.
Right. Not yet. I don't think we have everything we need in place. We're going to have the testing in place, the capacity to run the testing. I think we still have a challenge with the collection sites, moving the testing into places where people are at risk employees, medically and socially disadvantaged people who don't have access to testing and have a higher risk of contracting COVID. On the tracking and the tracing, some states are investing very heavily in that, others aren't. And so there's not a uniform approach across the country. So I don't think we have a good system in place. And what we're going to lack in the fall is really an awareness. We're going to lack a very good central data capture tool, a way to tell what counties are expanding the infection. Where is it expanding in the country? Right. So that you can make closures and take mitigation steps on a local basis and on a regional basis, rather than having to go to a simultaneous national shutdown, which is what we had to do this spring.
Hey, Doctor, a behavioral science question of sorts, which is if 2 or 3 weeks from now we find that we've dodged this, meaning that there's not a terrible spread as a function of these protests and people being in as close contact as they were, what do you think that's going to say about the way the public thinks about this virus, the way they think about experts, health experts who are making warnings about the fall? Are you concerned about that?
Well, I'm concerned about the risk that there might be spread coming out of these protests. I'm not concerned about the politics of the pandemic and the decisions that we made from a public health standpoint. I think there's going to be plenty of time to look back and make judgments about what we did right and what we did wrong. And I think that we'll find we did a lot of things right and we did a lot of things wrong. I think it's going to be hard to tease out, though, what the impact of these protests has been on the spread, because we're going into them with rising spread in a lot of states. And so what we're likely to see is continued rising spread in a lot of states. And remember, a lot of these protests weren't just local individuals. And so there were a lot of people from broad regions. And so it's going to be hard to say, well, we're not seeing spread in New York, but you might see spread in Philadelphia and New Jersey. Well, is that a result of the protests in New York? We won't know. But we're seeing rising cases already going in a lot of states. And I think we're going to continue to see that trend through the summer. That's why I'm worried about the summer. I don't think we're going to see an epidemic in July and August, but I think we're going to be taking an awful lot of infection into the fall. And we're going to have sort of this slowly expanding epidemic all through the summer.